these are our Schlick sensors, and they're very expensive. They cost about $8,000 to $9,000 for them, and they're very sensitive to abuse. So we want to take really good care of them. So there is a process for barriering the sensor for asepsis, and there's also a process for plugging them in and unplugging them and coiling them appropriately. So I will show you that whole process. So if I'm getting ready to prepare for patient treatment, I will plug into this port right here, and then I will barrier my sensor using the size 2 sensor barrier that are found in the drawers. We're going to press this gently into the barrier and get it prepared for patient treatment. Now the secret is, at the end, we want to be sure that we're taking this barrier off appropriately without pulling on the cord to get it out of the barrier. So I call it the toothpaste method, where we just kind of squeeze it out of the barrier. So I'll show you that again. In the barrier, we're not going to pull it out with the cord. Never pull on the cord. We're going to squeeze it out. I call it the toothpaste method. And then I drape, because this is contaminated. I'll throw this away, and I'll just rest it on a chair gently. Then I'll take off my gloves, re-glove, and then I will disinfect the sensor with the appropriate Cava wipes. You don't want to use Virex or any other of those materials. It has to be a Cava wipe, alcohol based. And then when we wipe the sensor, we do not want to get this area of the sensor wet. Keep in mind it's been barriered, so it's not highly contaminated. The contaminated portion of the sensor is the cord. That's what we've been touching and has not been barriered. So we're going to disinfect the cord well, and we can give the sensor a little wipe, but we do not want to wet down this area on the back of the sensor. Then I have disinfected my sensor. I'm going to put it into the port unbarriered. Okay, that doesn't go in there with even a clean barrier on it. Then take off my gloves, and I'm going to disengage the connection. The one thing we don't want to do when we're hanging up our cord, it's kind of like a garden hose. If you get it in the habit of being coiled really tight, then it'll tangle easily. So we're doing a very loose coil so that we don't train it to do bad things.